Okay, we can go ahead and get started this morning. Again, thank you all for attending TMACOG's Water and Wastewater Operator Training on this new web-based format. I'm Kari Gerwin, the Director of Water Quality Planning here at TMACOG, and I'm also joined by two other TMACOG Water Quality Planning staff, Barbie Kalta and Matt Kennedy. Barbie and Matt will be administering the polls and taking your questions for the speakers. I'd also like to give a big thank you to our presenters for their time in preparing this valuable training, and to our sponsor, Jones and Henry Engineers. They've been very instrumental in helping us pull together this event today. So before we get started, I'd like to provide a short overview of this webinar format. All of you as attendees will be muted, but we encourage you to participate in the discussion using the questions function. And you can see on your screen that this is the little conversation bubble with the question mark in it. And that's in your webinar toolbar. You'll also see in your webinar toolbar some other functions such as hand raising and a chat box, and we will be monitoring those and trying to be as responsive as possible. But again, please submit your questions for the speakers through this question function. Any questions that we don't get to during the webinar today will be addressed in a follow-up email by our speakers. I'll also mention that you will be asked to participate in a total of 6 polls during this webinar. It's important that you participate in these polls because they help our presenters get to know you, and they also count toward your webinar participation score. So we'll talk more about the participation score in a moment. You'll also be asked to participate in a survey at the end of the webinar. This is also a mandatory component of your participation score. So make sure after the webinar you stick around for that survey. Now we're going to go ahead and launch our first poll. This is actually a test poll just to make sure that everyone has a chance to check it out and to get used to this polling mechanism. And this will not count towards your participation score, but we do ask that you participate. So the first question, you should see it on your screen. What best describes your job title? So go ahead and fill in the answer that best describes your job title. And Barbie will let us know when all of the responses have come in. Barbie, do we have most of our responses?
We have about 90%.
Okay, so if you haven't had a chance yet to take that poll, we'll give you another few seconds to do that. We'll want to make sure that this works for you since this does count towards your participation score. All right, we can probably go ahead and wrap that up.
So it looks like from our results, we have a significant amount of wastewater and professional engineers, but we also have a lot of other, and then coming in last is water operators.
All right, thanks, Barbie. And thanks to all of you for participating in that test poll. So today's webinar has been approved by Ohio EPA for 1.75 operator contact hours. In order to receive these contact hours, you will need to be able to prove that you've actually participated in this webinar. So Ohio EPA does require us to monitor both your attendance and your participation. And again, this is how we're able to offer these contact hours through a web-based format. So in order to receive these contact hours, you must have the webinar as your active screen for at least 90% of the time during this entire training event. This means that you cannot use other apps or other windows or have any other windows active during the webinar. As I mentioned, you must also participate in the GoToWebinar polls, such as the one we just launched. However, the answers you provide will not be graded, and those answers will not count towards your participation score. So don't worry too much about getting hung up on the correct answer for those. Now, immediately following the webinar and before you log out, you will be asked to take a mandatory survey. This survey also counts towards your participation score, so make sure you do that at the end of the webinar. Also worth noting, excuse me, any technology issues that you might have, such as loss of Wi-Fi connection, or if you would happen to get booted off of the webinar, will actually impact your participation score. So if you do lose your connection, you'll just want to make sure to get logged back in using the link we provided as soon as possible. And then again, because we are offering the contact hours, we do ask that you complete the TMACOG contact hour request form. So here's a look at today's agenda. Today's agenda will include 2 presentations with a 5-minute break in between the presentations. So during this break, please do not log out of the webinar. You'll also want to make sure that you leave the webinar active and open because we are still counting your participation score, but this is an opportunity to get up, stretch your legs, get a drink of water, and anything else you need to do within 5 minutes. So with those announcements out of the way, we will go ahead and get started with our presentations today. And I will go ahead and introduce our first speaker. Our first speaker today is Adrienne Nemura. She is a principal at Geosyntec Consultants, and she's from the Cleveland and Akron region. She's responsible for helping her clients address various aspects of Clean Water Act compliance. Adrienne provides project direction, project management, and senior technical input on a diverse range of water and natural resources projects. She holds an MS and a BS in civil engineering from Virginia Tech. Adrienne, thank you for joining us today and for your presentation, and I will let you take it from here.
Great, thank you, Kari. So this is a rapidly evolving regulatory framework where the science on the standards that we're using to judge pollution and the treatment technologies that we have are not really keeping up. And there's a lot of hype, some of it worthwhile, some of it not. And so my goal is to really make sure you have a solid understanding of the background associated with PFAS, what the standards and the methods are, and also the sources. And then our sister state, Michigan, adopted what I'd like to call a reasonable approach towards addressing their contamination problems. And then also make sure you're aware of what might come next. So even if this is focused on wastewater, but even if you're a water treatment plant operator, I think that you'll find this information useful. I'm just having a little trouble with advancing the slides. Seems to be stuck.
Adrienne, if you click into your slides, you should be able to start advancing again.
Yeah, I've done that. There we go. Okay, so PFAS stands for per and polyfluoral alkyl substances. So it's a broad category of synthetic chemicals. What they share in common is they all have a carbon chain that is bonded to fluorine. And the per just basically says you have all the carbon except the last one is attached to a fluorine. And the poly means at least one carbon is attached to fluorine. And there are long chain PFAS, and then there are short chain PFAS. And the long chain PFAS are really the ones that are very persistent and thought to be the most impactful on human and aquatic life. And then the short chain are deemed to be less of a problem. So they do have some very desirable characteristics. They repel oil, grease, and moisture, which is why we all have them in many of the products that we use and like. They're highly resistant to temperature. And because they reduce friction, they're very good in manufacturing. And they really started out in the 30s and the 40s by 3M, and they manufactured the long chain PFOA and PFAS, which really is what has been driving a lot of the regulatory action. In 2006, EPA said, okay, we do not want these chemicals out there, and the manufacturers voluntarily agreed to phase them out. Now, this does not mean that we aren't importing products that are made with PFOA and PFAS. That can happen too. And so we really tried to replace these with safer alternatives. They're very widespread. They can bind to blood proteins, and they typically, when they're long chain, have long half-lives. And we really are still determining what the health effects are. We have a lot of analytical challenges that I'll go into, and they're transported in air, sediment, water, and wildlife. So this is a chart that is really useful that shows you when, these different compounds were manufactured and when we started switching. And the thing that isn't shown on this slide is their use in the medical technology field. So there are many medical devices that we rely on, for joint replacements and heart valves and things like this. And so these chemicals, because of their properties, are used in those. So, just an outright ban against PFAS in general would be very difficult for society. So why did this become such a hot topic in the press and in Congress? Well, what happened is this attorney got a call from his grandmother, and he used to visit his grandmother and her farm, that the neighbor's cattle were dying in Parkersburg, West Virginia, and this is where DuPont was manufacturing Teflon. And the workers were reporting cases of Teflon flu. They were observing birth defects. Because there was very high exposure in the manufacturing and around this plant, and the plant was also just dumping the wastewater into creeks. And so, the cattle were drinking out of the creek, and, the health effects were just stark. Their eyes would turn blue when they cut open, their organs were blue. The cattle that were normally very docile became very aggressive and were attacking the farmers. So this paints a really bad picture. And worse, DuPont had documentation that they knew that these effects could be real, and they did not provide that information to EPA. So that created an incredible mistrust by the regulatory agencies as well as the public. Then we had The Devil We Know, which is a movie that shows you some of the cover-ups that occurred, and it was released in January of 2018, and it really talked about Teflon and DuPont, and it did win, or it premiered at the 2018 Sundance Film Festival. There are also some similar movies like Fed Up and Under the Gun that have also been effective in generating public outcry and the call for action. Whoops. If you go to the Environmental Working Group's webpage, they have a map that it's interactive, and they've assembled data on military sites, drinking water sites, and other known sites. And so you'll see Michigan has a lot of clusters there, as does New Jersey, New Hampshire, Maine, Massachusetts. And this also serves to scare people, because they look at it and they go, oh my gosh, I really have a problem. And the problem is that they really didn't do a lot of quality assurance of these data. They don't distinguish between low levels of contamination versus very high levels of contamination. So it's fairly misleading. And if you read some of their reports, the big takeaway is that US EPA can't be trusted. Facilities that don't release results, including wastewater treatment plants, water treatment plants, are trying to hide things. And unless everyone tests the wastewater and the drinking water, we can't be safe. And that's poor public policy to take those types of approaches. Then, most recently, we had another release of a film called Dark Waters, which basically goes into more of the cover up and the problems, and it's sort of a thriller, and it had grossed like $11 million as soon as it came out in the box office. So what happens with PFAS? Basically, you get it in the soil and the water. The plants uptake that. When the water evaporates off the plant, it leaves PFAS behind on the plant. And so this is why this farmer in New Mexico had to basically exterminate all of his dairy cows, because they were eating hay that he was growing on his land. And he cannot use that land for anything. And it's a real problem. But this particular farm was next to a Department of Defense site where they actively tested firefighting foams for airplanes. And so, he was dumping 15,000 gallons per day of milk, and then he decided he had to exterminate, and that was 4,000 cows. This plume from, it's actually two major Department of Defense in this area, is threatening the Ogallala Aquifer, which is the largest aquifer in the nation. It extends 174,000 miles, and it covers 8 states. So it is a problem. But again, the short chain PFAS accumulate in the plants, the long chain PFAS stay in the soil, and every compound is different. So it's a very complicated problem to clean up. So this is a curve that shows if you have it in your blood, what percent of the chemical remains after so many years. So if you look at PCBs, which are, and dioxin, those are chemicals that we've been dealing with for a long time, they have very long elimination curves. It can take decades. If you look at Gen X, which is a short chain PFAS that was purposely manufactured to be safer, it really only has an elimination curve time of 1.8 years. So when you look at the toxicity data, the researcher that put these curves together recommended that for Gen X, that the safe standard would be 70,000 parts per trillion. If you look at what's in blood levels, well, when EPA launched that stewardship program, you started to see dramatic decreases in blood. So eliminate the source and get results. And so 70% of people being tested since that voluntary stewardship program was enacted, there was a 70% decline in PFOA, an 84% decline in PFAS, and then for HXS, we weren't testing for it in the late 90s. You know, those levels are also very low. I also like, when we're talking about human health standards, to connect EPA and CDC. And over the last 3 decades that I've been involved in water quality standards, this is starting to occur more and more, which is a really good thing. So what CDC put out was some guidance for doctors or, you know, clinicians that said, you know, if we're testing for blood and a patient says, you know, I've got this in my blood, you know, is that what's making me sick? The CDC basically says, you know, you have 2 responses, which is, you know, okay, you do have a health problem that might be associated with exposure to PFAS, but they have to put it into context that, you know, we don't know if the fact that you were exposed to PFAS is, you know, made you get sick or is making it worse. We don't have the data. But if their health problem is not potentially associated with it, then you basically say, look, you know, we still don't know, so we're looking, so we might know more in the future. So CDC is not out there saying there's this huge public health crisis that, you know, we really need to tackle. So now we have the question.
Looks like we have about 88% of our votes in, so if you haven't voted, please make sure to do that. Give you a few more seconds.
Oh, good. That makes me feel like I was helpful. There we go. All right, so now we're going to talk about standards and methods. And if and when Ohio approaches developing some standards, then you might want to consult this particular document. It's a really good approach to how do we, you know, go about setting state standards that are going to result in meaningful public health benefits. So US EPA, in response to congressional pressure and mandates, issued an action plan in February 2019 as to how that agency was going to help develop standards. It was recently updated in February, and I will discuss the challenges with the laboratory methods later. You'll note that method 537, which they established, is for drinking water. It is not for wastewater or biosolids. They're still doing research on the human health impacts. They're still trying to find ways to reduce PFAS exposures, because you saw how successful that voluntary source program was for the manufacturers. And they really recognize that states need help with stakeholders and risk communication. And this is why you need that help with stakeholder and risk communication. So this is a real, February 2020, you can look at a bunch of news. PFAS is always in the news, and EPA is pretty much always blamed for not doing enough and not acting fast enough. If you look at Dr. Linda Birnbaum, who was the director of the National Institute of Environmental Health Sciences, she recently retired and was interviewed about PFAS and said, this makes dioxin look easy. And so this is really, and of the thousands of PFAS, really there's only a fair amount of data on 2 of them, which is the PFOS and PFOA. So it is a very complex problem. And this is for the Interstate Technology Regulatory Council. They are a nonprofit that reports to the Environmental Council of the states, which is basically who the state EPA directors report to. And it's a very good resource on this particular topic. The ITRC's mission is really to make sure that they eliminate the barriers to effective cleanup of, water, air, soil, and that, we focus on allowing innovative treatment technologies to advance rapidly, as opposed to being held back because of regulations. So let's talk about North Carolina. North Carolina is at the heart of the PFAS in terms of drinking water standards, because there is a industrial facility that manufactured PFAS and then voluntarily switched to manufacturing Genex. And there was contamination of downstream drinking water sources, not all from this facility. There was also contamination of well water across the river from the facility because of air deposition. So they adopted for Genex a drinking water standard of 140 parts per trillion, and compare that to the 70,000 parts per trillion that was recommended by the researcher on the elimination curves. And it's calculated to protect fetuses and bottle-fed babies based on a lifetime of exposure. So it assumes that they're drinking from that same contaminated source over their entire lifetime. It's based on evolving information. It's really not a boundary line between safe and dangerous levels, but it's perceived that way. Somebody tested their local honey and found Genex in it that exceeded the 140, and there was a flurry of news articles about, we're contaminating the honeybees. But it is being applied as a surface water quality standard at very low river flows, because that's how we develop effluent limits for our wastewater treatment plant permits. And so when you layer conservatism on conservatism on conservatism, you spend a lot of money on treatment, and there's a lot of public angst that is a result of that. I don't know. There we go. So the same researcher that did those elimination curves, his observation was that to approach that, getting in your body the levels of Genex that would be a problem, you would have to consume 6,000 cups of water per day from the most contaminated tap for your entire life. That's a very conservative level of public protection. So Michigan, which we're going to talk about soon, these are the standards that they adopted for PFOS and PFOA. You'll see that for PFOA, it's 420 parts per trillion. And then for surface water, if it's not a drinking water source, it's 12,000 parts per trillion. So they are working at trying to set some standards that maybe are not quite as strict, but we'll see where that goes. And then they recently have proposed drinking water standards in this March that for new PFAS. So they're still, working on this. And the HFPODA, that is Gen X, so they're recommending 370. You don't have to necessarily just worry about it in your wastewater effluent. You also need to worry about it in your biosolids, even though we don't have tests that are standard methods for measuring that. And what happened in Maine is there was a dairy farm that PFAS tested in the soil. They were finding it in the cow's milk. And by the way, there's no studies that have been done on what happens if people drink contaminated milk, and what should the level of PFAS be in milk. But basically, this farm received biosolids from wastewater treatment plants, and it also received paper mill sludge. And so there's been a lot of finger pointing at municipal biosolids, and Maine basically put, prohibited land application. And then they had to struggle with, well, where do we send it? So they had to set up emergency funds, and, they really took a public policy approach as opposed to a science approach. And there were pretty serious ramifications that the New England states are still dealing with. So this Northeast Biosolids and Residuals Association is also a very good source for information on this. And I think in Vermont, New Hampshire recently was going to adopt drinking water standards. And when they looked at the cost benefit of it, there was really a 10-to-1 ratio. And they're looking at, 240 million of investment in treatment technology at water treatment plants to meet these standards, but you're only going to get about 26 million in human health benefits. So let's talk a little bit about the method that EPA does have for drinking water. It is based on the mass spectrometry method. And here are some of the analytes that they can measure. There's about 140 of them. There's no EPA-approved testing method for PFAS or its precursors for wastewater or biosolids, and also not surface water, groundwater, or recycled water. So laboratories are using other methods for wastewater and for soil. But in my experience, it's really bad to establish limits on dischargers when the methods aren't standardized, because you can lead to perceived exceedances that are strictly due to the laboratory method. Sorry, it's not advancing again. Okay, so if you do decide to sample, what should you do? If you go to this website, you can get a list of accredited laboratories that can use these methods. A soil test will cost you about $300, an effluent test will cost you $2,000. So it is expensive to do testing. There are some laboratories that are for these manufacturers, they have on-site laboratories that have worked out an agreement with the state where the method has a higher detection level. So the state agrees, okay, if you test it on site and it is not above that higher detection level, you don't have to send your sample off to this on-site lab. Off-site lab, sorry. So a lot of the problems, and you should know this also from mercury sampling, right? If you don't use the right equipment and you don't use the right methods and you don't take the right precautions, you can contaminate your own sample. So these are just some of the examples of what you need to do if you are sampling. So for example, if you have sample bottles that have to wait for a while before you fill them, you need to cover them with PFAS-free plastic wrap. And a lot of plastic wrap has PFAS in it. You have to use certain detergents, and you have to make sure that the tubes and your other equipment don't have any of these in them, you know, including, say, pens with water-resistant ink. So now we have question 2.
And Barbie will go ahead and get that poll launched. I did want to mention that I've seen a couple of comments that the polls might not be working for everyone. So if you are having any issues with the polls, if you could please just send us a chat. That way we can document that you've been having issues and that it shouldn't count against you. Well, while we're waiting for those polling questions to get answered, Adrienne, thank you for the great background information on PFAS. I thought I knew quite a bit about PFAS, but there's so much I think that we all still need to learn. And I think your discussion will also help to set the stage for what Michael Deal will be talking about later on with drinking water.
Yeah, it's all tied together. And I will comment that Michigan, I don't have it in my presentation because I just got the link last night. They released a report on the information that I'm going to describe. So that, again, would be a really good resource.
And we'll be following up to this webinar with an email to all of the attendees. So we're happy to share that resource with everybody as well, if you can provide that.
Great.
Thank you. And Barbie, it looks like we've got about 94% who have voted.
Mm-hmm. A few more seconds and then I'll close it.
Okay. Having trouble advancing again. There we go. All right, so now we're going to talk about sources. So, you know, the typical way that, you know, we approach this is, you know, landfill leachate is typically full of PFAS. Certain industrial dischargers, chrome platers, et cetera. Municipal wastewater treatment plants, we have contaminated runoff. And then we also have contaminated groundwater. And then that goes into the river, and then that comes out as drinking water and gets sometimes gets treated with granulated activated carbon. Sometimes it doesn't. And again, the standard that we're looking at is for a bottle-fed infant. And then we have these other exposure routes that can really only be addressed through source control. So here are some of the sources. There is a report by the National Association of Clean Water Agencies that discusses all of this, so that's a really useful reference as well. So if you have a wastewater treatment plant and you've been accepting stormwater runoff from a military base, you probably want to take heed of that. Hampton Roads Sanitation District in Virginia Beach recognized this early on and basically, said you can't discharge your stormwater to our wastewater system. Airports, they also use the firefighting foam in, either for training, or it is still the best way to put out a fire in a burning airplane, whether it's in the passenger or the cargo. So you need to be careful about that. There are alternatives now to that firefighting foam, but there's historic. But if you have any metal platers, etching, electroplating, commercial businesses that discharge, all sorts of things, laundries, landfills and leachate, centralized waste treatment. So you really should be screening the people that are discharging, or the businesses and facilities that are discharging to your collection system, and then maybe look at that and see if you need a closer look. These are some of the industrial sources that have been problematic, automotive services, wire manufacturing, refineries, hospitals. You can also run into the sources on the right-hand side that can cause problems as well. And then, as I said, they're ever present in commercial and consumer products. And so, pesticides and herbicides. And, I do think that the link there takes you to one of the nonprofits that is really trying to educate consumers. There's different classes of chemicals. For some classes that are toxic, there are much safer alternatives, and it's your responsibility as a consumer to try to purchase those less toxic products. They do categorize places where more research is needed to find better products. And so I'm optimistic that with consumer pressure and education and the manufacturing world, as well as the world of regulations, that we're going to, hopefully evolve into, let's try to not put these things out in the environment and then require wastewater treatment plants or water treatment plants to clean them up afterwards. So here's Michigan's approach. They created a PFAS Action Response Team, or MPART. They have a website. It's a very open and transparent process. The governor was, we've got PFAS problems in our state, and we had our Flint drinking water crisis, and we are not going to let this turn into another crisis. And so the MPART advises EGLE, which is the Department of Environmental, Great Lakes and Energy. And as part of this, EGLE developed a systematic approach specifically designed for Michigan wastewater treatment plants. And basically they did a statewide study of influent, effluent, and biosolids. And they said, okay, we are going to go after industrial pretreatment programs and try to make sure that we use that information to characterize the potential risks from a POTW. So first, they looked at what was in the influent, and they put your plant into, low risk, medium risk, high risk, and then depending on which bin you were in, you had different requirements. You might have to do source reduction. You might have to do semi-annual effluent monitoring, or if in your high risk, you need to do it monthly. They had POTWs develop local limits for PFAS and develop pollutant minimization plans, and then also some biosolid sampling. They did form a separate work group on biosolids, and they also had an approach for effluent permitting that they developed. And this was with input from various stakeholders in MPART. So in 2018, they sampled 95 plants, and first they did a desktop screening of industrial users. Then they sampled those industrial users and the POTW effluent. And then again, they focused on source control and reduction of discharges, including pretreatment. So when they found, say, a metal plater that was the likely source, the metal plater put granulated activated carbon treatment or ion exchange resin on their discharge before it got to the collection system. And Michigan saw a dramatic improvement in the effluent quality. And like I mentioned, we'll email you the link to the report that provides more information on this. But the good news was that 72% of those plants really didn't have any sources, or their effluent was below the water quality standard. And it didn't take a lot of time. It was only a 6-month process. So here's what they found. You know, the AFFF is that firefighting foam. It ranged for PFOS from 240 to 45,000 parts per trillion. Paint manufacturers were sort of next. Landfill leachate could be a significant source, but you know, the hospitals, et cetera, and industrial laundry facilities were not quite as problematic. In terms of the biosolids, recall that Maine shut down biosolids application. Michigan said, all right, let's look at our land application sites. And if they were industrially impacted, and this is a term that has now been coined across other states, meaning you had those industrial sources, they were causing problems in your effluent. We sampled the biosolids and saw high levels. So if those biosolids went to a land application site, it was deemed industrially impacted. They developed an approach for doing the sampling. They processed the sampling, and then they looked at some fate and transport methodologies, you know, to try to better understand what they were seeing in the soil tests. And they developed a guidance for land application. And they did use some of these studies, like Decatur had a pretty comprehensive study on land application. They did some literature review. And what they did is, if they found that you had, you were causing industrially impacted biosolids land application, and there were only 6 of these, they suspended the residual management program. So those facilities had to hurry up and get landfill agreements. And then I did ask the question when I was getting this information. I said, so what happens if one of those 6 POTWs shows that through their pretreatment program, their biosolids is clean? Could they resume land application? And the answer was, that's a good question. We don't know. So it is a good reason to sort of get out ahead on your pretreatment programs, so that you know you don't end up in the bin of, oh, you can't land apply your sewage sludge. So what's next? Eagle is putting on a PFAS summit. Whether that's going to be virtual or live is still to be determined, but it is October 27th to 28th. So, you know, you might want to consider registering for that, or finding somebody in your utility or a friend that might be attending that. We are starting to see some PFAS-related lawsuits against municipally owned wastewater treatment plants. This is Burlington, North Carolina. They have 2 wastewater treatment plants. And the Southern Environmental Law Center sued Burlington on behalf of the Haw River Assembly, which is an environmental group. And basically they said, hey, we have evidence that you found PFAS and 1,4-dioxane in the industrial wastewater that you're accepting at your 2 plants. And we went out and we sampled the Haw River and we found it. And we also got a sample from a public library fountain that exceeded drinking water levels. So that confirms that you have polluted the Haw River and the drinking water source. So they have sued under both the Clean Water Act and the RCRA, which is the remediation law. And if you ever have to deal with Clean Water Act and RCRA, it's a very onerous process. I've been on a couple of those projects, and US EPA has not figured out a good way to have those two programs work well together. So if we have a conversation in Ohio about PFAS that affects wastewater, I would strongly encourage you to, go back and refresh yourself on this topic. Really think about what is coming into your wastewater treatment plant. We still don't understand what happens to PFAS once it enters a wastewater treatment plant. And there are all sorts of things about the soil water partitioning, and we're still trying to study that because there are cases where the influent to the plant is less than the effluent, and the question is why. And then make sure that you have alternatives for biosolids application, whether that be landfill or potentially an incineration. Because if we have to deal with this in Ohio, I think an approach like Michigan took, where the stakeholders are involved and it's a thoughtful process as opposed to what some of the other states have done, that would be a really good thing.
Okay, looks like we're at our last polling question for Adrienne's presentation. So Barbie will go ahead and get that launched in a moment here. Looks like it's showing up on your screen. While we're waiting, you'd mentioned these lawsuits, Adrienne. As we see more and more of these and as they gain momentum, do you anticipate that we'll see additional lawsuits, both or either against municipalities or against the sources of PFAS? Where do you see that going?
I do see more lawsuits against municipal POTWs. I mean, we've seen this in, with combined sewer overflows and consent decrees. We've seen this with when there's a, if there's any perception, well, the cynical side of me says that Ohio has, for whatever reason, escaped many of the lawsuits that occur in other states, because typically you either have a environmental activist group that has, if they latch on to PFAS as being a concern, that's all they care about, and they want that fixed. And Ohio seems to have a good relationship with the wastewater treatment plants, seem to have a good relationship with the environmental groups, and I hope that continues. We're starting to see that erode a little bit with the harmful algal blooms in Western Lake Erie Basin. There's an environmental law and policy center suit against EPA for failing to do a TMDL in Western Lake Erie Basin. And so it's those types of, I hate to use the word, and I don't know what word to come up with, but single-minded missions that ignore the realities of science and actual risk. So I think in Ohio, we're not going to have to worry about it until we start collecting effluent data. But once that effluent data starts showing exceedances, then I think the best strategy is to really engage the environmental groups in the conversation about, look, you know, we have so many demands on ratepayer dollars that we need to make sure that whenever we add a new mandate, that we're truly getting the benefit that we need. And I think PFAS is one of those areas where we may overestimate the public risk because we don't have the science, and the benefits may not be very clear.
Well, and I think, I'll mention that we've got about 91% of folks who are able to vote. So if you haven't gotten your vote in yet, just go ahead and do that. It seems like this is just another example of where, you know, an issue of contamination or other pollution does, in addressing that, does fall back on municipalities and eventually ratepayers. So it's really, really pretty sticky situation. All right, well, Barbie, I think we can probably close that poll out. I think we've got everyone voting who will. Did we see the results? Did they already pop up?
Yeah, they popped up.
Yeah, the results already came up.
Okay, all right, Adrienne, I'll hand it back over to you.
Okay, well, I hope this was useful for folks. And I'd be happy to answer any questions that you all have. The course number is up at the top of the slide, and you can download the course from the form from the handout section of your controls pack.
Thank you, Adrienne, for your presentation. So I'll forward a couple questions to you that have come in from different participants. So the first question would be, if biosolids go to the landfill, won't their leachate create problems as well?
Yes, there on the Cape Fear River, the wastewater utility there spent a lot of money to gear up to be able to accept landfill waste. And then this PFAS thing hit, and so they had to stop accepting that landfill waste, which again, you know, is a source of revenue, right? That relieves the burden on the residential ratepayer. And the other problem with the landfills is they will install treatment, but it still like comes out, right? Because you can't always collect all the leachate and effectively treat it. So the treatment for the most cost-effective treatment for PFAS and landfill leachate would be granulated activated carbon. And the issue is that you typically have to install multiple GAC units because you don't know when the PFAS is going to break through the carbon. So the only way to make sure you can comply with an effluent limit for that leachate would be you have a unit, you observe, you hope you switch to the next unit before you hit that breakthrough point, because these tests, the methods are not, you know, particularly if you have to send it off to an external laboratory, you know, it may be a week before you get your test results back, if that. So yeah, it is a problem.
And speaking of those tests, are there any current efforts to standardize testing, or what have been the barriers to that standardization of tests?
Well, I'm not an analyst, so what I do know is that EPA is working on standardizing those tests, but they you know, have focused on drinking water first. And then I think because we have problems in soils, and this happens like, a car fire or a truck fire occurs, the firefighters respond, they use foam with PFAS, and now you've got soil that's been contaminated, and then that leaches into the groundwater. You have a lot of sites where either PFAS were manufactured or they were used. You have contaminated soil that needs to be cleaned up. So I think the focus next will be, on soil. And so when and if they get to trying to standardize the methods on wastewater, I don't know. And I'm not sure if the Water Research Foundation is working on methods. I think they will be, because they are actively doing research with EPA on trying to understand the movement of PFAS through wastewater treatment plants. So these methods are getting developed by different people. US EPA is working on it. US EPA is collaborating with the Water Research Foundation. Some states are working on trying to develop their own methods. Some, like as part of some of the consent decrees against the manufacturers, they are on the hook for developing methods. So, and then we also have other countries that are dealing with this issue as well. So, we'll get there eventually. I just don't know exactly when.
Then we had another question regarding kind of the amount of, so with the $240 million in investment by treatment plants leading to 26 million in human health benefits, are those annual statistics, or what's the time frame on those?
That was based on New Hampshire, and if you go to that Northeast Biosolids Association, their website, you can find this in one of the news releases. That was when New Hampshire was considering adopting a drinking water standard, and the researcher from MIT that did the cost benefit analysis basically calculated that it would take 240 million in water treatment technology to get those treatment plants down to the levels that were being considered. And they calculated the human health benefits, based on the human exposure. And the researcher pointed out that we don't even really know what the human health benefits are. First off, we don't know, like when people are exposed to these chemicals, we really don't understand what the endpoints are. There's some evidence that you have liver toxicity or whatever, but we've taken animal studies and very conservative assumptions and basically said, well, if we get down to this level in the water, and water is your primary exposure route, then this is the lifetime exposure that you have to have. And so my question on that is, we aren't really talking about lifetime exposures. And also in surface water, right, it's not like the contamination is a constant level, right? It's sort of, I don't want to call it voodoo calculations, but it's based on a bunch of assumptions, and there's so much conservative risk built into this, because when people want to be safe no matter what, right? And so we focus on a specific chemical, and in this case, they're working on methods to improve the risk calculation, but a lot of states are also adopting total PFAS, so they add up the concentration of all the individual PFASs, and they say it can't be more than 140 in total, right? And the way they do that is for PFOS and PFOA, it assumes that toxicity is additive. Okay, so if you had 10 parts per trillion of PFOS and 20 parts per trillion of PFOA, you're essentially being, the 30 parts per trillion total will cause the same as the exposure from the 10 and exposure from the 20. And then what we do for the shorter chains is we multiply that by a factor, so we might say, okay, these other congeners, the short ones, we're going to multiply those concentrations by 0.1. But that's all based on a lot of assumptions. So, in my mind, if you're taking very conservative assumptions and you're getting, sort of that 240 million versus 26 million, well, a better public health investment might be focusing more on source control, and working with POTWs and other dischargers through trying to get rid of the sources.
All right, Adrienne, thank you. That was a fantastic and very comprehensive overview, and I think everyone's going to have a lot of great information to take away. I know we do still have some additional questions, so would you be willing to answer those in a follow-up, and we can send those out to everyone through email?
Absolutely.
All right, and you'll see Adrienne's contact information is up on the screen, and I'm sure she's also willing to take any questions or follow up that way too.
Yep.
So with that, I would like to let you all know that we'll be taking a short break. It's going to be about 4 minutes. So if you'd like to take a little break, just make sure that you stay logged into the webinar, and also keep the webinar screen as your active screen. And we will get started with our next presentation. Michael Deal of Ohio EPA will be discussing Ohio's PFAS action plan for drinking water. So we'll start that at 11:15. All right, it looks like we're at about 11:15, so we'll go ahead and get started, jumping right into our next presentation. Today we have with us Michael Deal of Ohio EPA. He's the manager of the drinking water program at the OEPA's Northwest District Office in Bowling Green. In his role, Michael is responsible for the regulation of public water systems in Northwest Ohio, carried out by a group of 16 inspectors and engineers, ensuring compliance with the Safe Drinking Water Act. Ohio EPA's Division of Drinking and Groundwater ensures public water systems provide adequate quantities of safe drinking water to millions of Ohio residents. Prior to his role in the Northwest District Office, Michael served in Ohio EPA's Central Office, coordinating statewide compliance programs. Michael holds an MS in Ecology and a BS in Biology from the University of Toledo. So, Michael, thank you for being here with us today, and I will hand control over to you.
Great. Thank you, Kari. Really appreciate you and your team setting this up for today and in the future. It's a good opportunity to learn a little more about PFAS. And I did want to take a moment to just express my appreciation to all the water and wastewater personnel out there for the work that's done every day. You know, it's times like these in crises that we really need to take a minute to recognize that this is a reminder of the importance of safe drinking water. It's always delivered on time, you know, on demand directly to our homes, and it's a phenomenal effort, and I personally thank all of you. So for my presentation today, I'm going to address Ohio's strategy on PFAS. We're really early in our understanding and work on PFAS in Ohio. But this action plan does represent a collaborative effort between Ohio EPA and Ohio Department of Health. And in just an effort to first identify the extent of PFAS contamination in our public water supplies. At that point, then we can make better decisions moving forward. Okay. So during my presentation, I will provide some background on Ohio's PFAS efforts and get into the details of the current sampling project. And this will include the sample collection process, the results notification, the management of the data, response to detections, and also the public water system expectations. Following that, I'll discuss some of the resources available to water systems and to the public, and then we'll close at the end with the time for any questions. And I do encourage you to submit questions through the chat function while I'm presenting, and then those will be forwarded to me at the end, and I can hopefully provide answers to those questions. So. Okay. So did have a slide in here for some of the background, and we'll call him PFAS 101. But Adrienne really provided an awesome detail on the background of PFAS, so I'm not gonna really bother going into any of it here. This is a really basic summary of what Adrienne provided in great detail, and really appreciate that presentation. So. But really important to the drinking water facilities is the science and understanding of the toxicity and fate and transport is limited, but it is rapidly evolving. So as that evolves, we try to apply a reasonable regulation that would be an assistance to our regulated facilities, but also protect consumers. It's also very important to know that it's currently unregulated in drinking water, but however, that is on the verge of changing. US EPA recently announced its intent to develop drinking water standards for at least the two PFAS compounds, PFOA and PFOS. The time frame for development of an MCL is currently unknown, but we do expect to hear more about the process soon. It takes a while to develop an MCL. Normally, and as that happens, the state has some time to follow up with our regulation and rules. So we don't intend anything happening on from an MCL standpoint this year, but likely in coming years. So at this point, I'll take a quick pause and we can put up the first poll question.
And I'll mention that we have had a few folks submit through the chat function. They're having some issues with the polls. So again, if you are one of those folks and you haven't let us know that you're having problems, please do let us know, and we'll see what we can do to still make sure that you get all of your contact hours despite not being able to participate. This is a new format for us, and we're still working out all the kinks.
Give you about another 30 seconds or so to answer.
And Mike, I'm assuming that you're going to give us the answer to this question later on.
Yes. Yep.
Great.
We're at about 83%. So if you haven't answered yet, please put your answer in the next couple seconds.
All right, look at that. We got a sharp crowd here today. Hopefully it's a slam dunk. We all at least have a subtle interest in science, and so we really want to get those samples analyzed at a lab. It's really the best way to tell what's there. Thank you. Okay, so with the goal in mind of addressing PFAS first, or looking at PFAS first in drinking water, last fall, Governor DeWine asked Ohio EPA and Ohio Department of Health to develop an action plan for PFAS in drinking water. The plan was released in December, and this sampling effort represents a governor's initiative and a critical first step in implementing the action plan. The plan is available on Ohio's PFAS website. I'll mention that a couple times here and provide a link and address and actually some screenshots to show kind of what's available later in the presentation. But really, the plan is there, and it's pretty straightforward. It does identify 6 objectives and strategies. And then on this slide, really highlighting the 3 objectives that are tied to this current sampling effort. So the first is to gather and provide sampling data from specific types of public water systems to determine if PFAS is present in raw and finished drinking water. That's kind of the first step. And then the second is to establish action levels for drinking water systems. As I mentioned, we don't have an MCL. We do want to put some threshold there that we can use to make decisions. And that's really going to be a collaborative effort between Ohio and the public water systems to aid in appropriately responding to contamination, and with the goal of protecting public health. And kind of the third part of that sampling effort is to develop and disseminate educational information to the public to increase awareness. It's a huge part of this. Adrienne really did a great job mentioning and talking about that. Really is an important piece. And so those are the three parts of the action plan really directed towards the sampling effort. And then the three additional objectives are to work with Ohio communities to identify resources to assist their public water systems. And that's, in an effort to implement preventative and long-term measures to really reduce PFAS related risks. The next one is to continue ongoing engagement to ensure the action plan for Ohio is adapted as the science evolves. So that's going to be an ongoing process. We don't want to be so rigid that we don't, aren't able to kind of be nimble and adjust to evolving science. And then the final objective is to assist private water system owners, so those folks with their own well, with the guidelines and resources to identify and respond to contamination. Apologize for that. Working at home with a 2-year-old here, so dealing with that challenge. But here's the website as promised, pfas.ohio.gov, and really a lot of good information. I'll touch on this throughout the presentation, but you can find the long list of the action plan in full detail there, along with a number of other resources. Okay, so with the sampling effort in mind, the big question that we get and was really the question all of us had as the governor, worked with our agencies to tackle PFAS was, who's going to be sampled. Michigan took an effort. I believe they sampled all public water systems. The effort in Ohio was adjusted a little bit, but really just to better understand the current levels of PFAS in our water supplies. We'll be sampling over 1,500 public water systems across the state of Ohio, and this will include all community public water systems, except for those that are purchased or consecutive systems. So those would be the kind of our distribution only systems without a source and treatment specific. The second group will be our non-transient, non-community water systems. And these are generally smaller systems that include schools, hospitals, and factories. And of that group of systems, there's approximately 250 schools and daycares that are public water systems that have their own source and some form of treatment. And so as this kicked off in February, we were able to sample 239 of those schools and daycares, and that was kind of our first phase of the sampling effort. So I would just say that, as kind of a caveat to this, if you're part of a public water system and you're not, one of these two groups included in the 1,500 systems, still recommended to be familiar with PFAS and be aware of kind of the ongoing efforts to regulate in the future. And I just say kind of at this point, not a question of when, but kind of it's now a question of when, not a question of if PFAS will be regulated. So keep in mind for everybody. Okay, so we talked about who will be sampled, and then the next question, kind of when we'll be sampling. So the sampling efforts started in February. Under the governor's initiative, the goal still remains to complete this initial sampling by the end of the year, end of 2020. And as a precautionary response to COVID-19, we did halt our sampling on March 16th. However, that will be resumed next week on June 15th. And we've used this time to work on our SOP, put in some additional precautions as with anything at this current stage, and really with an effort to protect the samplers and the public water system personnel. This next phase kicking off next week will start to include the community public water systems, and will be conducted, over the next few months as we kind of, our contractors who are doing the sampling will be going county to county. So talk about where we are sampling. So in general, the plan is to sample finished and raw water at our public water systems. The finished water samples will be collected at the designated entry point taps that are used for a lot of our chemical monitoring programs. This should be familiar to water systems. And at some of our larger systems, they may have multiple entry point taps, and we will be sampling each of those entry points for each facility. We're hopeful to get raw water sampled at most of our facilities, and and this sample will be collected at raw water taps or sampling points when they are readily available. We do recognize that there may be systems with multiple wells and that do switch or blend sources routinely. And really due to time and resource limitations, we won't be able to sample the sources currently in use when the sample contractors are at the facility. And then also the availability of a tap that's easily accessible. So in the event that we aren't able to get a raw water sample, we will collect that entry point or finished water sample. So many systems in Ohio may want to conduct further source water evaluation of each of their sources, and it'd really be a good exercise to inform contingency planning and also source water protection efforts. So we do encourage source water sampling by the water system. Okay, so the next question would be, what are we testing? As Adrienne mentioned, there's the US EPA method 537.1, and which does provide results for many PFAS compounds. We're only going to evaluate kind of the 6 parameters that are listed here that are addressed under the action plan, and of which we have action levels established in the action plan. So this table shows those action levels. You can see there's a lot of variability between the different parameters. And important to note, the reporting levels for 5 of the compounds is 5 ppt, except for Gen X, which we do have a reporting level of 25 ppt. Okay, that brings us to our next quick poll.
Mike, you had mentioned source water protection plans and efforts. Have you seen any of those efforts begin to address PFAS, or is everyone really just waiting on guidance in order to look at source water protection for PFAS?
Yeah, that's a great question. So initially in Northwest Ohio, for any of our public water systems here in Northwest Ohio, we haven't seen that yet. Kind of early discussions only. However, in Southwest of Ohio, Dayton and the surrounding areas there, they've kind of been on the forefront in Ohio and been dealing with some levels of PFAS. So that has started to be adopted in some of the source water protection efforts in that area. So.
Okay. And in early sampling, are you seeing some differences? I suppose you would be seeing differences depending on the source. Is there anything you can talk about on that yet, or is that too preliminary?
It's still pretty preliminary, and by source you mean like whether it's a surface water system or a groundwater system. Right. Yeah, so actually in our initial sampling round focused on the schools and daycares, which I would say probably in their entirety are all groundwater systems. So unfortunately we don't have that comparison yet, but there was concentrated effort to focus on those schools and daycares first, and to use that as a, they're smaller systems and simple treatment and that sort of thing. So I will share the results actually later in the presentation.
Oh, great.
Actually, I think it's the next slide. So. Good segue there, Kari.
Well, and I'll admit that was entirely unintentional. Barbie, how are we doing with response to the poll?
We only have about 80% or 83 now of people that voted, so a couple more seconds.
All right, looks like we're stuck at about 86%. So I guess Barbie's going to close that one out.
All right. Nice job, group. So the majority did get it right. Is a lifetime exposure health advisory level of 70 ppt for combined PFOA, PFAS. Okay, as promised, we do have some early results. This is from the first phase of sampling that we did target our schools and daycare public water systems. This is from the 239 schools and daycares that were sampled, and kind of as a general summary of the results, we did detect all the compounds that were tested for except for Gen X. We had no action level exceedances in any of these systems, and as Kari identified one significant group that we haven't tested, that's any of our surface water systems utilizing a lake or a reservoir, or river, any surface water source. So there's a lot that we don't understand still at this point. These are very preliminary results, but anytime that we don't see any huge numbers, we're excited about that. And actually, I didn't break this up by within the state, but we have had no detections in any of our Northwest Ohio counties during this first effort. So we're happy to see that. And as they come up, we will deal with them. It's part of this, and we'll get into the details of that later in the presentation. Okay, I'm going to touch on sample collection and kind of how we're taking care of that in this initial sampling effort. Based on the time frame given to us to try to complete this initial sampling round by the end of 2020, we did made an effort to utilize contractors, and these were already under contract with Ohio EPA under kind of our existing level of effort state contracts. So it was a pretty good switch to that. Oops. Okay. So you'll see the three contractors listed there: Brownfields Restoration Group, Mannix Smith, and Tetra Tech. All the contractor personnel have received in-person training from Ohio EPA on unique sampling protocols required for PFAS sampling. And then, just an additional level of oversight, contractors are work directly with our contract manager and our project QA officer as a kind of an auditing effort for the sampling. As Adrienne touched on, there's cross-contamination concerns with PFAS sampling, of which is specifically addressed in the sampling SOP. So for the laboratory analysis, Ohio EPA has some contract laboratories for this project. All the results from the labs, these contract labs, will be submitted through the sampling contractor and then to Ohio EPA in order to take part and be a contract laboratory in this project. We are looking for that NELAC certification or an approval by Ohio EPA's Division of Environmental Services. Any confirmation sampling, if we do have detections, will be conducted by either Ohio EPA staff or contractors. But those results is kind of a cross comparison will be analyzed at Ohio EPA's lab in Reynoldsburg, Ohio. Okay, so to schedule sampling, really I'm gonna try to buzz through the next couple slides just to make sure we're covering everything completely and to make sure I'm using good use of everybody's time. So there is going to be initial point of contact from Ohio EPA. At that point, you will get a call, the water systems will get a call from our contractors to schedule that sampling. A contractor will conduct that sampling event and maybe possibly some of our Ohio EPA teams, our audit teams, will be on site during sampling, but not for everyone. Oops, I skipped forward here. So the pre-sampling preparation is pretty key to this, and really want to make sure we're doing everything we can to ensure quality results. So in order to do that, it'd really be helpful if the public water systems were able to identify entry point and raw water taps, and then also ensure there's clearance, at least like 9 inches of clearance for those taps. Important to remove any PFAS containing supplies or equipment and get those far from the taps if possible, and identify ways to purge the system or flush the system. And it's extremely important now as we go into some potentially some of our smaller systems that are businesses that may have been closed, to flush that system that they should be doing anyways before the water is used, to make sure we're getting fresh water from the system and not what's been sitting in the plumbing. And then if the water is being used and currently being produced and used by the system, still be good to kind of run that tap for about 2 minutes prior to sampling collection, just to make sure. So after we get the contractor gets the sample and it gets shipped off to a lab, we will. Is that you, Kari? Seeing okay, I think we're good. So results will be provided to Ohio EPA approximately 4 weeks after sampling. We've seen that time frame reduced a little bit, but it really depends on lab capacity and where they're at, what kind of the number of samples they're getting. So if the preliminary results indicate a finished water detection, so that entry point sample is at least 50% of the action level, the lab will be calling Ohio EPA directly to provide notice of that result. And really this advance notice gives us a chance to provide early warning to the public water system. All other results, non-detects or below that 50% mark, will be shared with Ohio EPA and then the water system after the sample review and verification steps are completed. It's important to, at this point, I really want to assure anybody on the line that's from a public water systems, every effort is being made by Ohio EPA to ensure that you get results at your public water system prior to posting on the web page. We don't want to go into a situation where something gets out on our web page and potentially in the media when you don't even know the results yet. So that is a top priority of our group. I'm going to run through a couple scenarios here and just kind of based on the results, what are our responses? So the first one is one that we've only seen so far early on here in Northwest Ohio, and that's if all 6 of the compounds are below the reporting level or non-detect. So in that situation, we get the results. Ohio EPA will get the results from the lab, and we'll notify the water system by phone or email. That'll be followed up with a letter to the public water system identifying the results were non-detect. The results will be loaded at that point onto the PFAS webpage, and really no further response is required at that point. Okay, the next scenario is if we see results that are less than 50% of the action level. That's for any of the 6. We'll receive the results again from the contractor. We'll notify the water system. The results will be communicated in a letter and explaining any of the follow-up requirements to the water system. And then for any finished water detections, there will be a notification to Ohio Department of Health and the local or county health department at that point as an obligation that we notify. So while these results aren't above the action level, really any finished water detection may require or may result in an inquiry from your customers and just the general public. And so really what we're trying to do is coordinate with Department of Health and to have all those outreach materials in place. And several of those are in what we call the public water system toolbox on our website. And really we want to assist with that messaging and communicating risk at that point to your consumers. We do have template letters that public water systems can use to notify consumers. And the next scenario would be greater than 50% of the action level, and that would include exceedances of the action level. And as I mentioned earlier, this will trigger kind of that confirmation sampling effort by Ohio EPA in conjunction with our contractors. And we'll be able to kind of fast track those results because those analyses are being handled by our Ohio EPA lab. So those lab results will be a little bit quicker within a week. And as soon as a water system does receive that initial notification, it's really important to start, peeling open that contingency plan, looking at source and alternate water options, really begin developing the customer messaging early on is key. Ohio EPA is committed to providing technical assistance as we see detections in our water systems. And there'll be a really small window, but still a window there for advanced notification and the confirmation results for the water system and us to prepare. And really just, want to note that our state and local partners will be notified and a coordination call will be set up to really begin development of the public messaging, outreach strategy, and then kind of the next steps based on these results. All right, so mentioned the confirmation sampling. Ohio EPA crews will be handling that once we're kind of released and permitted to return to normal field exercises and field work. But we also have our contractors lined up to handle that. Those will be hand delivered to our lab in Reynoldsburg, quicker turnaround on the results, and possibly additional sampling depending on the situation. So for action level exceedances, these are, so trigger a much more robust response from all parties, and it really has to. So just want to, reaffirm that this is a cross agency as well as public water system coordinated response. We'll be working with the water system to really develop that PFAS response action plan and ways that we can try to reduce PFAS levels as quickly as possible in that finished water. So if we do see an action level, just important to let the water system know it's important to implement the action plan right away to reduce the levels. Really, transparency and notification to consumers is extremely important. And then the contingency plan, implementing that and any efforts identified in the contingency plan. And then also that collaboration is going to be key between local health departments, state health department, and Ohio EPA with the water system to really ensure that we have consistent messaging and we are kind of all speaking from the same point of view. So I am going to, in an effort of time, breeze through this, but as promised, we do have pfas.ohio.gov. There's a lot of information on there currently. This will be the place where you can access results, and currently can as well. It is live. We do have a GIS, some GIS layers that are here. So you can click to the results from that main PFAS page. Really here, there's 3 tabs that are important. The first is kind of an introductory tab. You go to this next one, this is sampling status of the public water systems. So this just is this is really binary, have they been sampled or not? We've identified with dots on here all the public water systems that will be sampled in Ohio, all 1,570 to be exact. And as you can see from the other day, this is the 239 schools and daycares that have already been tested. This does not display the results, just whether or not they're tested based on the shade of brown. The third tab up here does show the results, and this is live as well. You can filter by county, by result, and the result is actually identified by a color-coded dot. You can see up here in our corner of the state, we have a number of systems kind of spread across the counties here that have been sampled with no detections currently. And then any of the yellow dots were detections that were identified at public water systems, but all have been below the action level. So finished water detections above the reporting limit will trigger this quarterly monitoring for at least 1 year. Any confirmed finished water detections above the action level will result in monthly monitoring for at least a year. Ohio EPA is planning to conduct and absorb the cost of that follow-up monitoring. That funding is still under review, and interested to see where that goes, but we are hopeful that funding will be approved for that follow-up monitoring. Quickly mention, PFAS detections are required to be reported on the CCR, Consumer Confidence Report, for our community water systems. And really the only effort, we mentioned the purchase water systems are not required or not part of this initial sampling event. They will need to report those results identified at their wholesale system. We will accept alternative data for this initial sampling effort. If a water system does already have data, quickly identify some of the criteria for acceptance. So we really want to look at the sampling procedures that have been taken and whether those line up with our sampling SOP. Has to be the correct method, certified or approved lab. We would need the raw data sheets or data sheets provided, and make sure that the QA does meet our standards. And reporting the parameters, it must include at least those 6 identified in the action plan, and the water system would have to allow us to report those results on the web page. To kind of meet all of those, we would forego our initial sampling in favor of this data. So I mentioned on our website we have the PWS toolkit, and that's under the public drinking water tab. Template letters, pre-sampling notification, FAQs, there's some treatment white papers, some fact sheets, just a lot of good information on there for our public water systems. There's also information for consumers. I think this was just an effort to identify the location on our website where you can find that toolkit. So, dealing with any contaminant costs money. We realize that. So we have set up some remediation 0% loans through our loan program, and they're structured just like the existing HAB loan program. Really, you can submit anytime. There's no limit to when you can apply for those loans, and treatment as well as source water protection measures are eligible for those 0% loans through the agency. So plug our website again, really the best source of information for this effort in Ohio. There's many other resources out there on PFAS. I encourage you to educate yourself, get up to date on the current state of the science, as well as efforts in each state to really deal with PFAS. And I think that's the final bit. We'll go on to the next quick poll.
All right, thanks, Mike. And I wonder if, I'm sure Matt's been getting some questions in the chat box, and I wonder if we could get to one of those questions while we wait for everyone to submit their poll answers.
Yeah, I can bring one up here for you. Who is paying for this initial sampling and testing?
Yeah, it's a great question. So Ohio EPA is the short answer. The state of Ohio has provided the funding to pay for the contractors to do the sampling, as well as the analysis for the initial sampling effort. The follow-up sampling, so that next year, if a water system is triggered into follow-up monitoring, that's the part that there's still some questions about the funding piece. We're hopeful to identify that and clear that up within the next month or so.
It looks like we're still waiting for some responses to come in. So if you've got any more questions that we can get to, we can go ahead and ask those.
Yeah, we've got a couple more. In regards to how you're taking the samples, how come they're not being treated like lead and copper as a first draw?
Yeah, it's a good question. And I think the reason for that in general is really lead and copper. We're looking at any contamination from the premise plumbing that happens based on the corrosivity of the water. So it's really the reason for lead and copper doing a first draw. With this PFAS effort, we're really looking at, is it in the source? So we got that raw sample. And if it is, what, are we removing it with the current treatment? So really first draw would not get us there. What we need is that treated water from whatever treatment is there at the public water system.
All right, Barbie, how are we doing on our poll?
We have about 94% voted, so a couple more seconds to get those last minute votes in, and I'll close it.
Okay, looks like the majority was paying attention. That's great news. Yeah, the decision was made in Ohio to focus on our community water systems with a primary source, excluding those purchased systems that are purchasing potable water, and also to include our non-transient, non-community water systems, which are generally businesses that have a certain number of employees that access the water each day. Really looking at, targeting the water that people drink in their homes or at work. Okay. So some contact information there. I did include the other district offices here. And really in the current state of affairs, Ohio EPA is much of our staff remains working from home. The best way to get in touch with us is by email. However, if you do contact any of our offices and leave a message, that we are getting those messages and returning your call. Mike Profit is the individual that is working with our sample contractors. And then for anybody that may be operating or working with a school or daycare, Bonnie Boothker, who's in our Southwest District office, is handling that portion of the public water systems and any questions related to that. So as you see there, the course number is identified at the bottom. My email address is really the best way to get in touch with our group here in Northwest Ohio. Our office is in Bowling Green, and we are responsible for all of the counties in Northwest Ohio. If you send me an email, I can get you the right person to answer your question.
All right, great. Thanks, Michael. It was a great amount of information, so I'm sure you'll have some additional links that we can send out to all of our participants following this event. Matt, I know we're right at noon, but if there are a couple of questions that we could get through before everybody signs off, we can go ahead and do that.
Yeah, there was one more that had come through the chat outside of what we'd asked earlier. So this one, do you know, is there bottled water subjected to PFAS testing to determine if there's any presence, or do you know if there's anything going on that side of drinking water?
Yeah, it's a great question. Currently not in Ohio, and Ohio EPA, through a regulatory authority to regulate public water systems, we do not regulate bottled water. I do think that that's important, just for my opinion, basically, that especially in situations where we may be replacing that public water source, if there's PFAS or other contaminants identified, many times bottled water is the alternative that is provided. So I do think it's important that those are tested. And I'm not aware of any national efforts. I believe bottled water is regulated by the FDA, and I'm not aware of any national efforts to test that. I could be wrong, though. I don't have all that information.
All right. If there are any questions that we did not get to today, we will go through all of those and make sure that we do get some answers for all of you. And we'll send those all out through a follow-up email. Adrienne and Michael, thank you both for your presentations today. This was incredibly informative, and I think a lot of information was presented that a lot of us weren't already aware of. So thank you for that. As we wrap up, I would like to just remind you all of a few things in order to process your contact hours. You were emailed a contact hours request form, and there's also one attached to this webinar today. You should be able to find that in the handouts section. So if you would please fill that out and return that to TMACOG by midnight tonight, we can start processing your contact hours. And we will go through and review the data for participation and issue contact hours to anyone who met those minimum requirements that we discussed earlier today. We will also take into consideration that some of you were having some technical difficulties, and I will talk to folks at Ohio EPA about how we can address those and still provide the contact hours that you earned. Then once we've processed all of the data, we will contact you of the hours that you earned and send you your certificate of attendance. And we will upload all of the qualified attendees to the Ohio EPA website within 30 days. And finally, there is a mandatory survey following this webinar. So before you close out of your browser, please make sure that you take that survey. Let us know how we did. If you did experience any issues with the technology, there should be some fields that you can fill in to let us know that as well. But we are having 2 more webinars in this series, next Thursday and the following. If you haven't yet registered for those, registration is still open, and you can find information on the TMACOG website to do that. So I'd like to thank all of you for attending today, and hope to see you at the next webinar.